Okay, welcome back, everybody. My name is Dr. Shmuel Shields. I'm a nutritionist. This 8-part health series, mini health series, pre-summer series is being sponsored by Chazak. If you have any questions or comments or want to give any feedback, please direct them to events@chazak.org. And Chazak is spelled Chazaq. Okay, we covered whole foods, rainbow nutrition, facts on fats, good carbs, bad carbs, best protein choices, hydration, managing blood sugar, and now we're going to talk in the last session on how to tie these guidelines all together, how to build better meals, and as a model, what I want to use, and again, it's a model that's been dramatically researched. I talk about it in my book that I wrote, 18 Chapters to Live By, L'chaim, 18 Chapters to Live By, and the model that I use in the book is the Mediterranean meal plan. I strongly try to guide people towards the Mediterranean guidelines. And what's so important about the Mediterranean way of eating, it's not really a diet, it's more of a lifestyle that's been adopted by the countries that surround the Mediterranean Sea. And basically, nobody really knows exactly, there's no exact formula for the Mediterranean way of eating, but there are principles that are sound and grounded in the Mediterranean way of eating that I like very much. And I think over the decades that this way of eating has been studied and researched, most of the research points in a very positive way to this kind of eating as a way to protect our health. And even if you suffer from a medical condition or a chronic health issue, this way of eating has been shown to best support, many medical conditions and health problems that people have, like elevated lipids, high cholesterol level, high triglycerides, blood pressure issues, blood sugar issues, even weight issues, and so on. The Mediterranean-styled meal plan has been very helpful. And what I try to do for my patients is I try to tweak the Mediterranean meal plan to their specific needs. So even the Mediterranean meal plan, like one size doesn't fit all, but has to be adjusted based on an individual's goals, health status, and so on. But what I want to do to finish up this 8-part series is to really just give you some of the parameters of what the Mediterranean meal plan is like. So basically, it's made up of only whole foods. There's no processed foods on this meal plan. It is primarily made up of colorful fruits and vegetables, which we spoke about, and the benefits of getting those kind of foods in the diet. It is not a low-fat meal plan. It is made up of about 40% of the calories in this meal plan are coming from healthy fats, avocado, nuts and seeds, olive oil, olives, and the fats that are found in fish, the omega-3 fats. And of course, even the whole grains that are part of this diet also add a little bit of oil, because there's fats and oils in many of the foods that we eat. And of course, nuts and seeds are a very basic component of this diet, which is another source of healthy fats that this diet is made up of. So we have the healthy fats on this way of eating. We have the colorful fruits and vegetables. We have whole foods. And protein, as I mentioned in one of our sessions, the emphasis is primarily on plant proteins. Next in line, you'll find fish. You will find some chicken, but not as much as maybe the fish. And last but not least will be the meat, which they use much more sparingly and in much smaller, serving sizes. So all I could say is it's a good model. Whole grains, as I mentioned, is a part of the plan, and they will use for the plant proteins, they will use things like lentils and beans, nuts and seeds, possibly some soy products that will fill the gap there for some of the animal proteins. And then, of course, fish is somewhat of a staple on the Mediterranean plan as well. So that's basically it in a nutshell, no pun intended. But the Mediterranean meal plan it's inclusive as in the sense that it incorporates pretty much all the food groups. I left one out, dairy products. So dairy products do fit in. Usually, the fermented, the dairy products like yogurt and kefir, the products that are used with the cultured dairy products. So these cultured dairy products do provide a source of friendly bacteria, which is very important to good health, and that's also part of the Mediterranean way of eating. They will use things like feta cheese and other cheeses and other dairy products as well, but again, they're not making cheese into the main dish, just like they're not making starch into the main dish or meat into the main dish. It's used there more as a garnish, so they may make a big salad and add a little feta cheese to it, or maybe you can cut up a string cheese into that salad, and it still has that Mediterranean feel to it. And you add a little bit of olive oil, and maybe some balsamic vinegar, and maybe some chickpeas. And you got the semblance of a meal there. Okay, so that's basically the Mediterranean meal plan. It's pretty balanced. It's whole foods. It's colorful. It has all the milas that we've covered in this 8-part session. Okay, again, I want to thank you for joining us. I wish everybody a safe and healthy and happy, successful summer. And I hope this was informative. And once again, if there are any questions or comments or feedback, please send your emails to events@chazak.org, and Chazak is CHAZAQ. My name is Dr. Shmuel Shields. Thanks once again for joining us.